Will you have a missing space if you get a dental implant? No one wants that. Hi, I'm Dr. Paul Anderson from Peachtree Oral and Facial Surgery here in Peachtree City, Georgia. Today, we're addressing a common concern. If I get an implant, will I have a missing space? Let's break it down. First, let's talk about what a dental implant is. An implant is a titanium post that serves as an artificial root, placed directly into your jawbone. Once it's healed, it supports a crown or a bridge, effectively replacing your missing teeth. Now you might be wondering, what about the gap? The good news is that with same-day implants, we can often place a temporary crown on the implant immediately after placement. However, sometimes this isn't possible. If that's the case, we can have a replica tooth made that looks natural and can fit inside a clear retainer or metal framework. And sometimes we can connect the replica tooth directly to the implant. This means you leave the office with a complete smile, without any visible spaces. During the healing period, which typically takes a few months, the implant fuses with your jawbone in a process called osseointegration. While it heals, the temporary crown helps maintain your smile and function. Once the healing is complete, we'll replace the temporary crown with a custom-made permanent crown that looks and feels just like your natural tooth. So no more gaps. In summary, if you get a dental implant, you typically won't have a missing space, especially with immediate solutions available. If you're considering implants, I recommend scheduling a consultation at Peachtree Oral and Facial Surgery to explore your options.